Welcome all for the today's session. So from today onwards, we will be starting a revision series for the MS and DNB candidates who are exam going. Basic purpose for this series is mainly to revise the high yield university topics, basically to learn how to write the answers then and how to score the marks. And we will also discuss common Viva and practical concepts. So whatever the topics which we are going to discuss, that will be discussed commonly for theory as well as Viva. Okay, so you need to focus on the concepts rather than memorizing anything. One thing you remember that you have already worked in the labor ward for 3 years. You have managed the emergencies, you have attended the emergency duties, assisted and performed the surgeries, worked in the OPDs, and that itself knows that you have adequate knowledge. The here, your problem is actually not the lack of knowledge. The problem is converting your knowledge into the marks in the examination, and that is exactly what this revision series what we are going to work on. Okay, so there are certain things which you should understand. First thing, you understand the nature of the examination which you are giving. Okay, so your university examination is not an MCQ type of examination. It is a descriptive examination, the presentation based examination, and time bound examination. So what the examiner is assessing, your knowledge, understanding of concepts, ability to organize the thoughts, logical sequence, clinical approach, and the presentation of your answer. Okay, remember, the examiner can assess only what you write and not what you know. So writing in a proper manner is very, very important. So when you start preparing, there are certain things which you should remember, that whatever is the time which is remaining during that preparation, you organize your study material well. Okay, so you will have various guidelines, you will have standard textbook, notes, etc. So keep ready your standard textbooks, notes, class notes, national guidelines, RCOG guidelines, NICE guidelines, important PDFs, etc. Okay, so you need to arrange everything topic wise. This will save you your lot of time, especially a day prior to the examination. You will be able to revise them in a very fast manner. Okay, and one thing which you should remember, that don't memorize anything, always understand the concepts. Okay, so when you are reading, always ask yourself, why is this, how this happened, when, what will be the next step, like that. Okay, so understand the pathophysiology, principles of management, indications, contraindications, complications. So any topic whichever you read, you please have the headings under which you are going to remember that particular point. Okay, so the concept will stay in memory for longer time than the memorized sentences. Okay, now what happens in the examination, have read a topic, maybe fibroid, maybe endometriosis, but the same topic can be asked as a long question, the same topic can be asked as a short note, say maybe semi-long question, it may be a Viva question. So whatever is the nature of the question, accordingly your answer should tailor. So for example, postpartum hemorrhage, it may be asked as a long question, management of postpartum hemorrhage, or there may be short note on balloon tamponade. There may be Viva question, causes of atonic uterus. So uh, or in practical, you may be asked immediate management in the labor room. So read one topic from all the angles when you are preparing. Okay, learn the technique of writing the answer. Knowledge alone is not enough. You should know what to write, what not to write, how much to write, and in what sequence to write. So this is going to be very, very important. Okay, so read the question carefully. Many students lose the marks because they don't read the questions properly. They write the topic. Remember, the marks are there for the question and not for the topic as such which you are describing. Okay, so the question is related to the topic. It doesn't mean that you have to describe the topic as such. You have to answer the question which is asked to you. Okay, it may be with respect to the particular age group, the fibroid and younger age group, the fibroid and the older age group. If it is given to you, the management should be tailored to that particular thing. Okay, and should not be the chapter which has been copied. So when you are read the question, you in the brain, you should underline certain things like discuss, enumerate, describe, management, diagnosis, complications. These are the words which are used in the questions. So every thing that this word will decide how you are going to frame your answer. Say for example, if it is a compare, it is always better to have the tables rather than description. Okay, so that comparison is very, very easy. Okay, the most important thing is the time management. You have been given 3 hours for writing the paper. So pattern will vary from different universities. For the DNB board, it will be a different, but generally there are long questions and short questions. Okay, so if you have got a two long questions carrying 20 marks each or six short notes carrying 10 marks each, there may be semi-long questions, 10 marks each also, especially for the DNB candidate. So you will divide the time accordingly. If it is a long question, maximum 30-35 minutes you can give. Short notes around 15 to 20 minutes, and always keep 15 to 20 minutes at the end of for the revision. Okay, never spend 1 hour for first question. This happens for with most of the students. They start writing and then there is a shortage of time. Okay, remember, marks are given for presentation also. So it's a very important. Marks are awarded for what you write and how you present it, not for what you know. But do not write. Okay, so what you know but do not write will not fetch you any marks. So presentation creates impression. Then how should be the structure of your long answer? So before writing, spend 30 to 60 seconds in planning how you are going to write this particular answer. So typical sequence will be introduction, definition, classification, etiology, pathophysiology, risk factors, clinical features, diagnosis, investigations, management, complications, prevention, conclusion, or the recent recommendation. So you will have the outline of the answer, especially for the long question you should do. You can write it in 5 to 7 lines in the beginning, so the examiner understands on which points you have written your answer. Okay, so if it is a short note, you need not write everything, but at least keywords which are the key concepts which are there, that you can note down in 2 or 3 lines. Okay, so the examiner knows that you know what exactly, and by any chance if you lag the time, if you miss something, at least certain concepts, the name, headings are there in your outline. Okay, so this outline will prevent missing any point. It will maintain the sequence. It will help to complete the answer within the time. Okay, so answer whatever is been asked. Suppose your question is asking about the investigations and management of one particular thing, and the pathophysiology is not asked. So don't spend lot of time or pages and pages writing for the pathophysiology which has not been asked. If you have been asked in investigations and management, you will stick to the investigations and management. But if you feel that you should write something about pathophysiology, draw just some diagram or some flow chart that will describe or enumerate only the factors, etiological factors. Don't describe them. Okay, so this is going to be very important. What you have read, what has been asked, keep the balance between the two. Okay, so write like an examiner wants to read. Okay, so instead of long paragraphs, you can use headings, subheadings, bullet points, numbering, etc. This will improve the readability. Then use the tables wherever it is possible. Tables are excellent when you have the comparison. For example, complete versus incomplete abortion, placenta previa and abruptio placentae, benign and malignant ovarian tumors. So what happens when you write in tables, it will save your time, it is easy to read, and you will score well. Okay, draw simple diagram. Okay, simple diagram will fetch attention, like female pelvis, then placenta previa, mechanism of labor, pelvic floor, etc. You should draw certain diagrams, and they need not be artistic. You should just draw simple diagram and you should label them. Okay, always use flowcharts. Flowcharts are ideal for management, investigations, algorithms, emergency treatment, decision making. Flowcharts are going to be very, very important. Okay, they give you the clarity. Then underline important words like headings, key terms, investigations, drugs, etc. Do not underline everything. Highlight only key points. Your handwriting matters. Good handwriting does not give you extra marks, but poor handwriting, you will lose the marks because of the poor handwriting. Okay, so write clearly, neatly, leave spacing, avoid overwriting. Okay, and you can use accepted abbreviations like PPH, CTG, PH, IUJR, etc. You don't use your own short form like triple H or something like that to describe HIV, HbSH. Whatever is a standard, universally acceptable short forms, abbreviations, you can use it. Okay, you should attempt each and every question. If optional question, you need not attempt, but write all questions which are mandatory. Okay, so never leave a question blank. Even if you know 40 to 50%, right definition, classification, important points, whatever you know pertaining to that, if you don't know complete, but remember that partial knowledge will fetch you some marks, but blank pages will not fetch you any mark. Okay. And always think like an examiner, because examiner has to assess 30, 40, 50 or 100 papers at a time. So if you have written it well, his job becomes very easy. Your answer should be readable within seconds. Examiner should immediately notice the heading, structure, important points, and the easier your answer is to read, the easier it is to award the marks. Okay, so the first page of your paper will create the first impression. So start neatly, proper heading, proper sequence, good spacing, well organized answer, and first impression often influences the overall perception of the answer. So final message is that do not study to finish the textbook, study to understand the concept, reproduce them systematically, present them in an examiner friendly manner, and remember, knowledge plus presentation plus time management will give you high score. Be confident. You have already learned obstetrics and gynecology while managing patients. Now we only have to learn how to present that knowledge in the examination. Okay, so this is what we are going to do in this revision series. We will go through important topics. So take home message is that understand the concepts, not the sentences. Answer exactly what has been asked. Present your knowledge systematically. This is what is the today's take home message. The university examination is not only a test of your knowledge, it is also a test of your ability to communicate that knowledge clearly, logically, and within the available time. Okay, thank you.